make a start in the interest of time. So good afternoon, everyone. I'm Vaughan Parsons. I'm the Centre Manager at the London Centre for Work and Health. So thank you for joining our July Lunch and Learn session. I will be presenting an overview in relation to the Engage study, which myself and some wider colleagues have been leading on in the last 10 months. And I'm just mindful that some of the people in today's meeting very kindly contributed to this research study. So it's great to have you involved in this Lunch and Learn session today to really get a bit more information about the outcome of that engagement opportunity. So bear with me a second. So just as a reminder, this session will be recorded and made available on our website. And I'll provide an opportunity at the end for any general questions that people may have. I will need to finish up slightly earlier today because I need to jump into another meeting straight afterwards. So just by way of background, so really setting the scene, as I mentioned, we applied to an IHR for a Work and Health Development Award early last year with really the aim of exploring how best to engage work and health practitioners, recognising that our colleagues come from many different organisations and professional groups. Our interest was really exploring how best to engage them in research and making use of evidence to inform their own practice. We recognise that this was really an area that needed a lot more research and focus, and particularly giving some thought to developing a future intervention that will hopefully improve the better use of evidence within practice across the various different professional groups. We know from existing research that's been undertaken principally in the Netherlands that there has been efforts made to try and improve evidence-based practice within the work and health field, but really there's still a lot of work that needs to be done in this regard. So we've felt that this was really a timely opportunity for us as a research group to lead on this piece of work. So just to really just thinking about the notion of evidence-based practice or evidence-informed practice within work and health practice, the traditional view is that academics and researchers will undertake research projects in our own little ivory towers, so to speak, and those research studies are then disseminated in formal academic journals, and we also disseminate at traditional scientific conferences. I think it's fair to say that in recent years there's been much more emphasis on the research community working more collaboratively with practitioners, but also wider stakeholder groups as well. And when we think about work and health practice, in terms of stakeholders, we're also thinking about the employers, the employees, the trade union reps, the charitable sector as well. So there's been much more emphasis on us developing and thinking about research ideas and topical research questions that really speak to and address practice relevant topics, if you like. And when we think about developing new interventions, also making sure that they are co-created with the various different stakeholder groups as well. I think also thinking about how best to work across the different stakeholder groups across the life cycle of research activities. So thinking about the very early stages of thinking about research questions or topical research areas of interest, thinking about the research methods that we may wish to develop to roll out these studies, right through to the end of studies and thinking about the research findings and making sure that they are relevant to policy and practice as well, and linking in and getting feedback from our stakeholder colleagues when formulating recommendations with regard to policy and practice domains. So when we talk about evidence-based practice within work and health, or in the field of work and health, we can look to various different models that describe and provide frameworks for evidence-based practice. But we feel that the one proposed by Brenner and colleagues back in 2009 really aligns itself very nicely with the provision of work and health practice, recognising that evidence absolutely comes from the traditional pathways through academia and through established research groups, but also recognising that practitioners rely on a diverse range of different evidence, if you like. And some of that evidence comes from organisations, and that could be with regard to available data. It could be with regard to seeking feedback and advice and experiences from managers and senior leaders. And it could also be thinking about the local contexts in which practice is occurring and in which we wish to implement research itself. So the aim of the Engage study was really to enable us to explore and understand better how practitioners currently use and access evidence, how they go about understanding and synthesizing evidence and then applying it to their practice. I think recognizing, certainly from our own anecdotal feedback, from our years of working with the practice community, that there absolutely are barriers and obstacles that practitioners experience when we talk about evidence-based practice. And some of it is logistical barriers, and some of it's systemic cultural barriers that really impede practitioners' utilisation and applying evidence to practice as well. We wanted to also think about what a future intervention might look like to try and aid better use of evidence and engagement of practitioners in the research field itself. And also to think about how we might roll out such an intervention in the future as well. So to lead on this piece of exploratory work, we implemented 3 specific work packages. So the first work package was a series of stakeholder consultations where we reached out to many different colleagues representing the various different professional groups, people working in the NHS, for instance, and also out into the independent commercial work and health sector as well. We also absolutely involved many of our professional membership organisations as well, such as the Society of Occupational Medicine and FOM as well. We also then undertook a national survey really to inquire and to seek feedback from jobbing practitioners around how they go about using evidence within their own practice, but also understanding their own skill set and knowledge and competencies around evidence-based practice, but also engaging in research and supporting the conduct of research locally. Towards the end of the exploratory research, we then undertook a wider stakeholder forum involving representatives from our professional organisations to really help us understand and interpret the findings from those first 2 work packages, and then to help us think about a future intervention or roadmap, if you like, to take forward to an interventional study. During the early stages of doing the Engage study, we absolutely made sure that we set up and consulted with an expert stakeholder and patient group. In traditional health research projects, many of you may have heard of the concept of PPI contributors, in research, and within the field of work and health research, we take quite a broad view when we talk about PPI contribution to make sure that we involve many of the other stakeholder groups as well, such as the trade unions and the professional bodies, as I mentioned before. So we established our ESPG group, who we consulted with throughout the 10-month study period as well. And they also were able to attend our Work Package 3 roundtable meeting. So I'm just going to walk through the various different work packages in more detail. Really just to provide an overarching view of the main findings from each of the pieces of work that were undertaken. So with the focus group sessions, they were undertaken last year, and some of the people in today's group contributed to those focus group sessions. We ended up interviewing 31 practitioners representing different professional groups. And we also reached out and undertook some focus group sessions involving our research colleagues as well across the UK. So this is quite a busy slide, but really just to summarise some of the main findings from the practitioners who contributed to the focus group sessions. And we've tried to map this out so it really speaks to some of the broad feedback themes, if you like, focusing specifically on how practitioners go about accessing and evaluating existing evidence, how they support the conduct of research locally. So that could be by way of undertaking service evaluations or audit activities, right through to supporting academics with the development and rollout of formal research studies at that local level as well. And then thinking about how evidence is then used to inform practice and influence senior leaders. And senior leaders could be senior occupational health leaders, but also could be senior leaders within commercial organisations where practitioners are advising them around health and wellbeing interventions or wider workplace health provisions. A recurring theme I suppose, throughout the exploratory research was the issue around protected or lack of protected time for practitioners to get involved in evidence-based practice and to access to understand and to synthesize evidence. We also found, and this was reflected in the survey as well, a diversity when it comes to practical skills around accessing evidence, whether that be through the traditional routes of journal databases or other source material as well. And many of our practitioners relied solely on existing evidence summaries or guidelines that are currently available, such as those provided through the professional membership bodies, but also Cochrane Work and other organisations as well. We recognised throughout the study that really what we needed to give thought to very early on was how we're going to address this issue around ensuring practitioners have more protected time to engage in evidence and research as well. Also thinking about some of the difficulties that practitioners have had historically around working with academics, around thinking about research projects and topical research proposals that really speak to topical areas of interest that practitioners are facing as part of their daily practice as well. So we